Good evening. Today is June 26th, and today I'll continue to talk about the coronavirus. So the first piece of news I'd like to talk about is that as the United States records more daily infections than ever before, it is confronting a perilous new stage in the outbreak. In a shift from the early days of the pandemic, where the virus rippled through nursing homes and older populations, younger people now are making up a growing percentage of new cases in cities and states where the virus is surging. In Arizona, around half of our coronavirus cases affect people ages 20 to 44. In Florida, the median age of people testing positive has dropped to 35 from 65. The reason for the changing demographics may be human nature. Younger people are more social, and as bars, beaches, and restaurants reopen, they're more likely to leave their homes to meet and mingle. That's raising concerns that asymptomatic young people or people without symptoms may be spreading the disease among themselves and to more vulnerable populations, such as the older population. Still, some experts are divided on the reason for the increase. Some believe that it could be a function of more widespread testing, while others argue that hospitalizations are also going up, indicating that transmission rates are higher. The virus is largely concentrated in the south and west, so I think young people definitely need to have more protection because they can get seriously ill as well. In California, where I currently live, Governor Gavin Newsom threatened to withhold state funding for counties that refuse to enforce public health orders. The governor said that the virus was spreading at private gatherings and homes. Outbreaks at some prisons are raising concerns. Today, the governor also said that it would advise against to stop reopening if counties are showing an increase in cases, which San Francisco has said. However, he did say that the final call would be up to the county health workers. So California has recently been hit extremely hard by the virus, and there's right now extremely large surge in cases. And after all, California is a very hot city, and many people, including me, just want to hide out to the beach or something. But we have to understand that safety is more important, and we need to keep inside to stay safe. Texas also had a severe uptick in infections and hospitalizations, and Governor Greg Abbott paused the state reopening plans yesterday and ordered hospitals in 4 counties to suspend elective surgeries. Many businesses that have reopened last month are still allowed to operate, although critics have blamed the reopening for contributing to the expanding pandemic. Mr. Abbott has said repeatedly that rolling back will be a last resort. Now, the state has recorded more than 130,000 cases and nearly 3,000 deaths. The second thing that I'd like to talk about is that plenty of cooped up people are itching back to the gyms, but it's doing so safe. New research funded by Norway, most likely the first randomized trial to test whether people work out at gyms are at greater risk of the virus, offers some hope. The 2-week study began in May with 3,664 members from 5 gyms in Oslo. Half were allowed to return to their gyms with instructions to wash their hands, maintain 3 to 6 feet of distance, depending on the activity, and stay out of showers and saunas. They did not have to wear masks. The other half could not go back. The study, which has not yet been peer-reviewed or published, ended with only 1 case of the virus in a person who had not used the gym before being tested. Based on the results, Norway, which has largely controlled the virus, reopened gyms this week with the safety measures used during the trial. Some experts believe the findings could be widely applicable, with one important caveat: the places where gyms reopen should have fewer infections. So this may be extremely good news to people who may be wanting to go back to work or working out. However, the small, often indoor spaces that are perfect for bars and tables and stools sitting side by side, poor ventilation, loud music that forces patrons to yell, move closer, and lowered inhibitions have shown that bars are extremely dangerous and during the coronavirus crisis, and that they should be closed. That's it. Thank you for listening, and I hope you have a good day. Thank you.